Hey guys, how we doing? Hanging out here with our girl. Yeah. Her name, by the way, is Yaban, which is Turkish for feral, wild. Pretty much sums her up. Last night was a vibe. We're working on things, but this video I want to talk a little bit about anti-anxiety medications in your dog, sedation in your dog, when it's appropriate, how to do it. This, of course, is really on a case-by-case basis. But, so, the foster home that had her for a week or two, whatever it was before she came here, had her medicated. I say sedated, that sounds harsh, but it's not like she was like sleeping. But she was on some pretty heavy hitters. She was on gabapentin and trazodone. And I'm not throwing shade at the foster mom that had her before, because I'm not. Because when you're a foster home and you know that it's just short term, just for the interim, you have to do whatever it takes for yourself to have peace, safety, sleep, and you have to do whatever it is that you have to do to make that happen. Your safety, the other dogs in your home, their safety, that's number one priority. And you need to be able to sleep at night. And you need to be able to function, and you need to be able to do all these things. So I'm not throwing shade at the foster home at all. I will say, when it comes to Anatolians, I'm really very careful with medications that I give them, especially, I mean, anesthesia, like if they have to have surgery, be very, very careful. They're very sensitive to sedation. Medication too, like especially trazodone. That seems like that's one of the first things that a vet is going to throw at a dog that has anxiety is trazodone. If they have anxiety, if they have like aggression, they're going to hit them with trazodone. I'm sorry, I'm trying to like get her in here and me be comfortable too. And I'm not completely in love with that. It does the trick, but there's also like this rebound effect a lot of times I see with Anatolians. So vets will give them the trazodone to try to get them to chill out and take the aggression down, and then there's this rebound when they start to come out of it that's quite rageful. So I really don't like to do that. So if I'm dealing with a dog with anxiety, I put them on an anti-anxiety. I can't say I put them on it, like the vet that I work with puts them on it. For instance, our OG Athena, when our main stud, our original stud Shiloh died, they were a bonded pair, and when he died, she had a really, really hard time. Like, I've never seen a dog go through depression. It was awful. She didn't know what to do. She was beside herself. She knew where he was buried. She would go up to his grave and lay there. She would cry. She'd cry all night. Like, it was awful. I never would have guessed that. I've never seen that reaction before. Anyway, so when that happened with her, we put her on Paxil. I had another Anatolian. Her issue was anxiety. Also started her on Paxil. When I first got her, she was just like an anxious mess. Went on Paxil. And so here's what I like. If you need to use an anti-anxiety medication, she's laying down. If you have to use an anti-anxiety, Jesus Lord, if you have to use an anti-anxiety medication on your dog, use it with purpose. So in the case of depression, that can get them through depression. But if you have a dog that's anxious, then use that as a tool to help you with training. So it's kind of like with people, if you're depressed or anxious and you get put on a medication, they also suggest counseling. Okay, so with your dogs, it's kind of an adjunct. So yes, do the medication, but then use it for training as well. So what I'm trying to say is, I'm doing a terrible job at explaining this, but So like give the medication, help that reduce the anxiety, but then expose them to that which is giving them anxiety. So I had a girl named Tipper. When I first got her, it was zero socialization. It was littermate syndrome. It was everything. She was scared of everything. She was scared of stairs. She was scared of the wind blowing, tractors, everything. It was horrible. So put her on Paxil, and then once that started to come into effect, then I took that opportunity for exposure. So you bring that threshold of anxiety down with your medication, and then you take that opportunity to expose them to that which used to freak them out. And then the goal is eventually take them off the medication, which is what I was able to do in both circumstances. So that's really what the goal in anti-anxiety medications for dogs are. I'm not saying it always works that way. Some dogs always have to stay on the medication, but that's never like ideal. That's never the ideal situation. Some dogs are chemically not right. They're wired not right, just like people, just like we are, and they have to stay on the medication long term. But in most circumstances, try to use it as just a short-term fix to get through whatever their problem is. So, like if Yaban was more anxious all the time in situations, I would put her on a Paxil, and then we would be exposed to whatever made us nervous. If it was like a lack of socialization, if she was nervous about things outside, then that's what we would do. We would do a Paxil, and then we would go for walks, and we would do this, that, and the third, and just continue to build up to her, that threshold of what she would be okay with dealing with. That's not her issue. She's not an anxious dog. She's anxious right now, but more like an acute anxiety because she's in a new place and this is all brand new. This isn't something that's so big that she needs a medication. She just needs time and consistency and a routine and bonding, and that's what she needs. And she'll be fine. She doesn't need medication. But some dogs do. So that's kind of my recommendation of how I go about. And some dogs just need for very specific times. 4th of July, for instance, is one that's, for a lot of dogs, it's terrifying. So if your dog gets ridiculously anxious to the point where they're hurting themselves, maybe hurting you, then, but that's not a Paxil situation. That's a Trazodone situation. That's a short-term, maybe a couple times a year, just to get them through one day of something, So different medications for different times are appropriate, and it's just feeling out what it is. And if you do have to use a medication, make sure that you're also combining it with a behavioral therapy, training, positive reinforcement, all that kind of stuff. So she's finally resting and sleeping. Yay for her. She'll get there. But anyway, so just my take on medications, anxiety medications, sedation, all that fun stuff. So I'll come back at you guys again soon.